How would you define a concussion?
So a concussion is a little bit complicated because a lot of injuries in the brain we see there's bleeding or there's a mass, and a concussion is not like that, and that's a little bit difficult. That's what makes a concussion difficult, I should say. So when the brain undergoes a force, if that force is great enough, what it does is disrupts the normal cell function. So the cells of the brain get disrupted. The cells of the brain are producing energy so the brain can utilize. When you're reading or when you're doing math or when you're exercising, the brain needs energy, so the cells are producing energy for that. You take a hit, and if that hit is great enough, it disrupts that cell function, and then it ends up where the brain is needing this much energy to function, but it can only get this much because those cells are not operating properly. They're not giving the brain the energy that it needs. So we end up with what we call an energy mismatch, where we need more energy than we're getting. And that's why oftentimes when we put stress on the brain during a concussion, we're increasing the energy demand, but we can't increase how much energy we can produce because the cells aren't working right. So that's why a lot of times symptoms get worse when we exert ourselves. So the concussion is a problem within the cells of the brain that happens because of a force that gets hit. That force can be a straight-on force, like a helmet-to-helmet hit. It can be a force that someone gets hit from the side and their brain gets rotated. As a matter of fact, we think that may be even more common, and that causes that cellular disruption to occur. And so what happens after a concussion occurs is we have to wait for the body to bring that back into balance, these cells to start producing normal energy amounts again, and that usually happens over anywhere from a few even hours to weeks. And usually the majority of patients I see, it's somewhere around 1 week, sometimes 2 weeks is kind of the normal for that to happen, to bring things back into balance. When that happens, normally symptoms go away, and then they start acting back to their normal self again, and that's when usually we think that they're back to, again, start beginning a progression back to play at that point.
All right, thank you.